About 75% of women experience painful sex at some point in their lives. For some women, it's just a temporary problem which goes away after some time, while for others, it's something they've been struggling with their whole life. In today's video, I am going to be sharing with you the causes of painful sex, the type of pain, the location of the pain, which will help you identify the type of pain you're feeling, what you should do when you experience painful sex, and the treatment. Hey guys, welcome back to my channel. To all my returning subscribers, I just want to say thank you for always coming back. And if you're just coming across my video for the first time, my name is Sandra, and this channel is all about health, relationship, lifestyle vlogs, and every other thing you can think about. Yeah, this perineia, which is the medical term for painful sex, is more common in women, though it can also occur in male. Guys, I'm going to try as much as possible to simplify this video so you understand every bit of what I'm going to be saying in this video. In my previous video on the 9 tips to keep your vagina healthy, I already talked about the difference between the vulva and the vagina, because a lot of women feel the genital area is the vagina. That is really not the vagina. The one you can see from the outside is the vulva, while the one inside is the vagina. You need to understand the difference, as that will help you know exactly where the pain is coming from. I'll be dropping the link to that video in the description box below. Do it to check it out after this one. Now let's talk about the causes of painful sex. There are two types of causes. We have the physical cause and the emotional cause. The physical cause is divided into two types, and these are the superficial pain and the deep pain. Please get me correctly so we don't mix it up. The two causes of painful sex are the physical cause and the emotional cause. The first one, which is the physical cause, is divided into two, which is the superficial pain and the deep pain. It is important we differentiate between the superficial pain and the deep pain. Now, the superficial pain, like when we talk about superficial, we're talking about the surface area of something, yeah? Superficial, that's the surface of something. This is the pain usually felt on the outside, like just around the vulva area. This pain is usually felt at the point when the man is trying to put his penis inside the vagina, just before it enters the vagina. You know, the pain you feel just at the surface as the penis is going inside. That type of pain is known as the superficial pain. The second one, which is the deep pain, is the pain felt internally. Like, this is when the penis is already inside the vagina and sexual activities are already going on and the man is doing his thing, like, you know. So that pain is known as the deep pain. You might start feeling that pain around your lower abdomen, inside the vagina, as in just internally. The pain might even get worse when you change sex position, as in, you know, that moment when sexual activities is going on, you just start feeling the pain inside, like it's like something is hitting on your womb. Some people will say, they feel the pain from my womb, that kind of thing. That is what is known as the deep pain. Now, what are those things that causes the superficial pain? Remember, we said the superficial pain is the pain felt just around the surface before the penis goes inside the vagina. Now, what causes that pain? Number one is some personal care products. Some additive, like in soap and body wash, can trigger inflammation around the vulva. And when the vulva area is inflamed, it can lead to superficial pain. Number two is infection. Infection can cause pain, itching, and changes in vaginal discharge. Examples of these infections are vaginal yeast infection, bacterial vaginosis, urinary tract infection, and some certain sexually transmitted infection. Meanwhile, I have a video on vaginal yeast infection in my channel. Do well to check that out. Everything you need to know about vaginal yeast infection is there. Please guys, check it out. Number 3 is vaginal dryness. I also gave an elaborate explanation on vaginal dryness and its causes in one of my videos. I will also be dropping the link in the description box so you can check it out. When a woman's vagina is dry, it is usually difficult for the penis to go in, and that can lead to superficial pain. And this pain is due to lack of arousal. Some men will not even have foreplay with their woman and just try to push the penis inside the vagina. How about, uncle? Take time to play and explore your woman's body so that she can be properly wet and aroused before penetration. Number 4 is vaginismus. This is when the muscles of the vagina contracts. Usually when the man is about to penetrate, the vagina just tightens up on its own. It makes sex painful and sometimes impossible. Some women go through this and it can happen to anyone. A lot of women don't like to talk about sex, but sometimes it is better to open up to your doctor. Your doctor can teach you exercises to help you relax the pelvic floor muscles and also help you loosen it. Women with this condition can experience superficial pain during sex. Number 5 is a problem present at birth. This is when a woman doesn't have a fully formed vagina, and this is known as vaginal agnesia, or the development of a membrane that blocks the vaginal opening, known as imperforated hymen. The 5 things I just talked about are the things that causes superficial pain. Now let's talk about number 2, which is the deep pain. Now, what are those things that can cause this deep pain? Remember I said deep pain are the pain felt internally, like inside the vagina and in your lower abdomen. Now, what are those things that can cause this pain in the vagina during sex? Deep pain is usually associated with gynecological conditions such as pelvic inflammatory disease. Pelvic inflammatory disease is an infection of the female reproductive system, which includes the uterus, the fallopian tubes, and the ovaries. Number 2 is fibroid. Fibroids are abnormal growth that develop in a woman's uterus, and it is usually non-cancerous. Number 3 is uterine prolapse. This is when the uterus descends into the vagina, and this happens when the pelvic floor muscles and ligaments become weak. Number 4 is ovarian cyst. Ovarian cysts are sacs usually filled with fluid in an ovary. During sexual intercourse, you might feel this stabbing pain if your partner hits the cyst. Number 5 is endometriosis. This is when the tissues usually found in the uterus starts developing outside the uterus. Number 6 is retracted uterus. This is when the woman's uterus is tilted backwards towards the woman's spine. It basically describes how the womb sits within the pelvis. Women with these kind of conditions may experience painful sex. Number 7 is surgery. When you have sex too soon after surgery, you may experience painful sex. When you have any of these health conditions I just listed, you may experience painful sex, especially when your partner hits deeper. So guys, these are some of the health conditions that can cause deep pain. Now let's talk about the second cause, which is the emotional cause. Remember I said we have 2 factors that causes painful sex. They are the physical and the emotional. And the physical factors are divided into 2, which is the superficial cause and the deep cause. The physical, which is divided into 2, they are the superficial and the deep pain. That is what I just finished explaining now. So right now I want to talk about the second factor, which is the emotional intercourse. I know some people will be wondering, like, what has emotions got to do with pain? Well, emotions are greatly connected with sexual activity. Hence, they might play a role in painful sex. These emotional causes can be classified into three. They are psychological issues, stress, and history of sexual abuse. Psychological issues has to do with anxiety, depression, when you have concerns about your physical look, fear of intimacy, or relationship problems can lead to low level of arousal, which can result to painful sex. Number two is stress. Yes, I know you'll be wondering what sex has got to do with painful sex, but the truth is, when you are stressed, the pelvic floor muscles tend to tighten up, and that can lead to painful sex. Number three is history of sexual abuse. When a woman has experienced rape or is being sexually assaulted, the thought of it can automatically make her lose interest in sex, which can also lead to painful sex. So guys, if you're going through this painful sex, just try and identify what's causing that pain for you, whether it's the deep pain, the superficial pain, or if it's the emotional pain. This will help you know what to do next or the right approach to solving it. Now let's talk about the treatment of painful sex. For the superficial pain, try simple lifestyle measures such as changing your menstrual product, wearing cotton pants, avoid using harsh care products to wash your vulva. Don't rush into sex. Ensure longer foreplay, as this will help stimulate the lubricant in the vagina. Try different sex positions and explore your woman's body to the fullest. If you're suffering from vaginal dryness, please go back and watch my video where I talked about the causes and treatments of vaginal dryness. Get it sorted out, because sex is meant to be enjoyed and not endured. I'll be dropping the link in the description box so it'll be easy for you to just locate the video. For the deep pain, since it's mainly gynecological conditions, it is really important you seek the help of a doctor. Lastly, if you think you might be suffering from emotional pain, then it is important you seek the help of a psychotherapist. This is where I come to the end of today's video. Please, if you've watched up to this extent, kindly subscribe if you're yet to subscribe. And I just want to say thank you for watching this video and subscribe. Like this video, share it with your friends. If you have any questions, you can drop them in the comment section. Thank you for watching, guys. See you in my next video. Bye.